Okay, this is Rich. I'm here at Central Florida Foot and Ankle Center in Dr. Jaramillo's office. I'm here with David, one of Dr. Jaramillo's patients. Thank you for giving this patient testimony, David.
You're welcome.
So, just to go back, can you just let everybody know how long you've been a patient with us? Do you remember?
I've been a patient for about 10 years.
Okay, 10 years. And do you remember the reason you came to see Dr. Jaramillo back then?
I had heel pain.
Okay. On a scale of 1 to 10, how bad do you think that heel pain was?
It was about an 8.
Okay, so you knew you had to be seen. Okay. And so you came in, saw Dr. J, and did she know what to do, or did she
knew
know?
Exactly what to do.
Okay. Do you remember what she did?
Well, she had to give me a shot.
Okay.
In my heel.
Cortisone shot, right?
And then she made me or asked me to get some orthotics.
Okay, custom orthotics then.
Yeah.
Okay, good. And how's the heel pain now?
Oh, it's not. It doesn't exist.
Okay, good. So it cured that. Okay.
Yes, it did.
But you still kept coming to see Dr. Jaramillo, but not because of the heel pain, but because, I guess, just to do your regular diabetic appointments?
I'm a type 2 diabetic.
Okay, good. So she wanted to keep an eye out just to make sure that there was nothing else. Okay, good. And I guess I understand you said earlier that you had another issue a few years ago. You had a swollen foot.
Yes, I did. I worked all day, and at the end of the day, when I got home, I tried to take my shoe off, and I couldn't take it off.
Because it was swollen?
Because it was swollen. Okay. And I had to cut the shoe off.
Oh, wow.
And my foot was black and blue.
Wow. But you didn't feel it?
I didn't feel it because of my neuropathy.
Okay, you had neuropathy. Okay, yeah. So, which has the numbness and tingling, and it's hard to have feeling down there. Okay, so you knew you obviously had to be seen.
Something was wrong.
Okay. And you called Dr. Jaramillo, and then
she made a point of me seeing her. Right. ASAP, and she worked me in.
Okay. And then what did she determine? What had happened?
She told me that I had a fracture.
Oh, wow. So you had no idea that you had a broken foot there?
No, I did not.
Okay. So you actually she had to repair the fracture of the metatarsal with a plate and screw, so you had to have surgery then. Okay. So how is it now? How is your foot now?
Oh, it's great.
Okay, good. So no issues there?
No issues.
Okay, good. So the heel pain and then the foot fracture, no issues with that.
No
right now you're just basically maintaining your regular diabetic appointments just to make sure there's no other issues. Right.
Yeah, but she cares about her patient.
Right, good. Well, I know she appreciates you saying that, so thank you. So I guess you're taking advantage of our diabetic shoe program as well?
Yes.
Okay, good. And you're getting those shoes every year?
Yes, I am.
Which help out as well?
And they are tremendous help.
Okay, good.
They relieve the pressure on my feet.
Good. And have you referred patients? Because I know since you've been coming here a
Yes,
while.
everybody that I've ever came across that had foot problems, I gave them the address and the phone number and told them to see Miss Jaramillo.
Okay, well, perfect. We appreciate that. Well, I know that Dr. Jaramillo appreciates the testimony and that you're doing so much better than you were before. So we appreciate you trusting in her.
Well, I appreciate her and all of her help, and the care just don't stop whenever the issue is finished. She does care on how your feet, the welfare of your feet.
Right. Good.
And how they're doing.
Right.
And if she knows you're a type 2 diabetic, she especially looks for any problems with your feet.
Right. Well, that's important. Good. Well, we appreciate you giving the patient testimony today, David, and thanks a lot. I'm glad you're doing better.
Thank you.